my name is Olivia and I'm going to be doing a cardiac assessment. What is your name and date of birth?
Piper Wolfter, February 1st, 2009.
Do you know where you are today?
The clinic.
And why are you here?
For a cardiac assessment.
Okay, thank you. So her general appearance is calm to relaxed and she is alert ×4, so she's good to set up by herself. First we're going to inspect her skin. Her skin is within good color. She has no edema, no lesions or bumps or anything like that. Her nails are good in color. She has good cap refill, less than 3 seconds, and there's no clubbing, and there's also good angle. So next we're going to palpate her extremities. So first we're going to look at her skin tuger and pull up on the back of her hand, and she is good. It's less than 2 seconds. Her skin is also elastic and even all over. Next we're going to check her appearance. Nothing shows abnormal. Her skin is all even and symmetric, and she has good range of motion on all of her extremities. And her collar is well all over. It's even all over her body and within good color. And she also is just normal temperature. She's not too warm or too cold. And then her capillary refill on her hands is less than 3 seconds. And then also on her feet is less than 3 seconds. Next, I'm going to look for any edema. She doesn't show any edema, no pitting edema, so she's good all over. Next, we're going to palpate the brachial and radial pulses. So first we'll check the brachial in her arms. They're both even bilateral and +2. Next, we're going to check her radial. And they're also equal bilateral. Next, we're going to check her pulse rate and rhythm. We're going to listen for 30 seconds. And then her pulse was 71 and equal bilateral, all of her upper extremities. Next, we're going to look at her lower extremities. So first, we're going to palpate her femoral pulses. And those are equal bilateral. Next, we'll do popliteal. Those are also equal bilateral. And then next, we're going to do her dorsal piatas. Those are equal bilateral, and then posterior tibial. Those are also equal bilateral. Next, we're going to check her blood pressure in her arm. Her blood pressure was 110/60. Next, we are going to go ahead and check it in her ankle for the ankle brachial index. and it was 115/65. So we're going to then divide both of the systolic measurements, and that would become a 1 for the arterial occlusion, which is in with a normal range. Next, I'm going to do the Allen test on my patient. So first, I'm going to cover both the radial and ulnar and make a fist for me. And then go ahead and release and open up your hand. And then I'll release, and all her collar comes back within 2 to 5 seconds, which is normal. Next, we're going to inspect the chest wall. So her chest is pretty normal, it's symmetric, the contour is well, and it's even. And then I see no pulsations on her chest, and she has no heaves or any retractions when she's breathing. So everything's normal there. Next, I'm going to inspect my patient's carotid arteries. So first, we're going to look for any pulsations. I don't see any just while looking at her. Next, we're going to go ahead and feel for her carotid arteries. So we want to make sure to only feel one at a time. And they are equal bilaterally, +2. And then next, we're going to listen for any bruits, and we will want to do that with the bell of our stethoscope. And those are all good. So next, we will want to go ahead and palpate for her apical pulse location. So it's usually right down here, and it is good. Next, I am going to listen to my patient's heart sounds at all 5 points. So first, we're going to start at the aortic, and then we're going to move to the pulmonic, and then Erb's point, tricuspid, and then the apical, we're going to listen for a full minute. And it was 68, so it is good and normal. It was also equal bilateral, and it was strong, and there was also no abnormal sounds, no extra sounds or anything like that.